Dr. Vikki Petersen here. I wanted to talk to you today about NSAIDs, which is short for non-steroidal anti-inflammatory drugs. These are very common drugs in this country, things like aspirin, ibuprofen, Motrin, Aleve, Celiac, naproxen. All of these are very common NSAIDs that are used. 60 million Americans take them on a fairly regular basis, so if you're one of them, you're definitely not alone. But they have side effects, and they have very serious side effects that most of us aren't aware of, and it's because NSAIDs, I think, are, well, they are over-the-counter drugs, so the reason people don't worry about taking them is we tend to think that over-the-counter medications are safe, and that's really not the case with NSAIDs. There's an especial danger for those with celiac disease or any sort of autoimmune disease, gluten intolerance, but this warning is not just for them. It's really for all of us. So here is how NSAIDs work. What they do is they take a chemical in the body that's called prostaglandins and they inhibit it. And prostaglandins can cause pain, inflammation, and fever. So that's why NSAIDs work very well to take down inflammation and pain and fever. So they do that, and they're good at that, which is great. But what's the side effect? Prostaglandins don't just cause you pain. They also do something very important in your stomach and intestines, and that is that they protect the, there's a layer protecting the lining of your stomach and intestines, and there's mucus that actually protects those cells from damage. If you think about the stomach's a bag of acid. Why does your stomach not just erode? Why don't we all have gastric ulcers and bleeding from our stomachs? With hydrochloric acid, you'd wonder why. Because there is that protective mucus layer. So what helps create that? Prostaglandins. So then, now understanding that, you see why a major side effect of NSAIDs is GI bleeding, hemorrhaging. Over 100,000 people a year go to the hospital because of gastrointestinal complaints as a result of NSAID use. It's killing over 15,000 people a year, and they feel that number is extremely underreported because a lot of times doctors don't know their patients are taking NSAIDs. We think of aspirin and ibuprofen as sort of nothing type drugs. It's not sort of, you say, are you taking any medications? People don't even sometimes consider those medications because they're such an integral part of something they take for this pain or ache or headache, etc. So it's not very well, it's not as well known as it should be of the problems, and therefore when there are severe complications, it's not appreciated that they're at the root cause. A very interesting component is that those with arthritis, now arthritis is an autoimmune disease, so those with arthritis have a much higher rate of complications. 60% of patients with arthritis have complications with NSAIDs. Why is that? So this is my opinion here, is that autoimmune disease, like arthritis, what we know is that a leaky gut, a damaged intestine, has a strong affiliation with autoimmune disease. Now that's well researched. My opinion is coming up here, and that is that if we look at all autoimmune diseases as a whole, first of all, they're the third leading cause of death, so that's important to note, but things like celiac disease and arthritis and MS and thyroid disease, there's a whole long list of autoimmune diseases, but what they have in common is that gluten is often a root cause, and a leaky gut definitely seems to be a common thread amongst these autoimmune diseases. So you put someone with arthritis with a fairly well-established likelihood of a leaky gut, and then you compound that with taking an NSAID. Can you see why a higher percentage of them are having gastrointestinal problems? And realize these can be so severe they can hemorrhage and die. So this is not something light that we're talking about. Now imagine someone has celiac disease or gluten intolerance and they're trying to heal their gut. They have a leaky gut as a result of their gluten intolerance. They're trying to heal that gut and they're taking an innocent NSAID in life, okay? And then you wonder why they're not healing. Do you see the problem we're having here? So these NSAIDs are very serious. They're very dangerous for everyone. They are particularly dangerous with those of us who have these autoimmune type problems. I could go on and on, but I'll save that for an hour-long lecture. But I wanted to just impart this information because I think it's very, very important. So please share it with those you care about, and let me know if you have any questions. And until next time, I wish you very good health.